Well, thank you very much for being here. I really want to thank Uli for inviting me. Interestingly enough, so I'm a vascular surgeon. I'm married to a surgeon. My brother's a surgeon. My dad was a great surgeon. I have 2 uncles surgeons, all in Massachusetts for a collective century. I have a daughter who's an aspiring actress. But my dad, actually a great thoracic surgeon, was in fact an inventor. He had a number of patents. He modified a lot of things. He had developed a lot of things for tracheostomy, a lot of things for pacemaker leads. His last invention actually sits on every chest tube tray in an 80% market share. We still get royalties from that, and we thought Dad was crazy inventor. If nowadays we'd call him a physician entrepreneur. So it's kind of weird to look at my dad with a different lens. He's been gone now 12 years. So what am I doing? So I'm a surgeon in private practice, and I didn't like the system, and I said, gee, maybe I have a way to change it. So we all know, we've heard this, talk about AI. This is what needs to be fixed with AI, right? You could replace all government with AI, but that won't happen anytime soon, but that's where it needs to be. The truth about it, all those things that we've talked about, all these things we've talked about all day today, let's see if I have my thing. The millennials don't use primary care. A common thing, someone goes to the emergency room, they say, you have to see a urologist, you have a kidney stone. Well, what do I do next? Go to my primary. I don't have one. That's a constant conversation that happens every day. Medicare for all, every time Bernie Sanders says Medicare for all. Rising deductibles, surviving the high cost. We have already talked about half of us are burnt out, half of us are now employed. We no longer work for the patient directly, we're working for someone else. And this is a crisis. And what's happened here, no one wants to pay surprise bills, right? We're not even in control of it anymore, and now price transparency is the law. So patients are paying more out of pocket for all of this. All of this is happening, and we're letting it happen in some ways, and patients are paying more. The deductibles are going up. People never reach their deductible. It's like Tantalus reaching for the grapes. You got to be dead before you get to your deductible. And all of this is uncompensated. We all live this every day. How did we get here? Well, if you look back in time, if you go to Bruges, if you've ever been to Bruges, there's a beautiful hospital. It's the oldest continuously running hospital. It lasted until like the 1970s, from the 1000. It was for pilgrims. I think when they installed electronic records, it finally closed. But actually, it was for the poor. It was free. Right? Doctors attended people in their homes. If you were poor, you went to the hospital. And interestingly enough, surgeons were apprentices that had to train for 7 years, just like us. So it was a really interesting concept that care was at home. And then when we had new technology, and of course I'm from Boston, I got to throw this slide up. When we started to have new technology, it became more expensive. And when it became more expensive, people needed to buy insurance. So they developed Blue Cross to cover when you went to the hospital, and then Blue Shield for your medical expenses. Fast forward to World War II. In World War II, Harry Truman put a wage freeze in because they didn't want factory workers leaving the factories they were working in and to go to a higher paying job because they needed them for the war effort. So they put a wage freeze. So how did factories get new people? They offered benefits, and voila, the employers are now paying. Now, if you're too old to work, or you're too poor, you have Medicare and Medicaid. And the very first Medicare patient was, anyone know? Harry Truman and his wife were the very first Medicare patient. So that's where we came. And then you now fast forward to where we are now. We have managed care, we have network restrictions. We've basically given up this whole thing. And it all just started because of a wage freeze in World War II. So now the inevitable consequences. Price transparency is gone, right? We don't even have, the employer's the customer, the government's the customer, the patient's not in this equation anymore, neither is the doctor. The patients are moving farther from the caregiver, and I'm gonna argue the caregiver is moving farther from the patient. We're like that Maxwell Smart. So I want to think, can we think differently? Can we fix healthcare from the bottom up? Can we really change the way we think of this? Not a hierarchical solution, but something from the bottom up. So when you try to apply economics to medicine, obviously the intention was always to increase the access and to control the cost with top-down solutions. We've seen so many algorithms in the last few days of ideas. Let's fix healthcare, top down, top down. But the reality is that we have a tug of war. Why? Because biotechnology is going too fast. It's pulling us into individualized care, and we cannot find a one-size-fits-all. And so it's fraying. So we are like running down like a drag racer, and the drag chutes are administrative bureaucracy and the obstacles that we have that is preventing us from adopting technology. And of course, navigating the hierarchy. It's crazy. Oh, I'm sorry, I have to use that? Okay. It's feedback. I'm electronic. Okay, is that better? Should I start singing? No. So navigating the hierarchy. I mean, we've already seen so many of these slides, but really it's just you get into like, when anyone tries to bring anything into a hospital, you end up with these like chambers and like, right? They're like, and you can't bring anything anywhere. You're in dead zone. But the medical relationship is a peer-to-peer contract. It is always that. We're not that complicated. It is a doctor-patient peer-to-peer relationship. It is directly accountable. 75% of people value this the most important thing in medicine, and it is personalized. And that's where technology is taking us. Not everybody's DNA is going to determine our healthcare in the future, not these like one-time-fits-all models. So where is technology taking us? So I'm a vascular surgeon. So basically Lipitor put me out of business. I was a vascular fellow eating a nice bagel from whatever drug company made Lipitor. And I literally was like, are you kidding me? I better find a side gig quick. So I gave up my, carotids and so forth. Luckily, I have veins, and veins are good because everybody gets genetic, and people get worse with time and obesity and age. So it's a good disease to bet on. But honestly, I used to operate in the operating room for like 2 to 3 hours on a case, and now I can do an 8-minute office procedure on it with low risk for my patients. I don't even operate on other patients. Technology is just remarkable, and it's continuing, and it's all done in the office space. But where is the patient taking us? The patient is not patient. They are looking for convenient options. They see nothing but obstacles. They are looking online. They're going into urgent cares. They're going to all these other places, and we need to acknowledge that. So they go to the doctor internet, right? That's the best referring physician there is today, is doctor internet. So why is medicine the only business when you pay cash, you pay triple? And what if we gave the patient the power to spend their own healthcare dollar?
It's not triple, it's
10x, yes, 10x. So we have introduced the very first patient-to-specialist direct pay platform, and we are UBERDOC. And no, we are not owned by Uber. We are registered trademark. We are 3 easy steps for the patient, set at the level of a 4th grader. You find the best specialist who's located nearby and available, and you pay a single transparent price of $300. $50 for the appointment hold, $250 when you're seen, $50 for Medicare. We are entirely Medicare compliant with this model. And for the doctor, 4th grade level, it is an emoji, thumbs up to get that patient. It is one simple step for the doctor. It is anti-epic. In the current system, you go to the ER, if you twist your ankle, you'd have to go to the ER, refer to a primary, back to x-rays, back to primary, you leave work 4 or 5 times, you pay a bunch of copays. In our model, you go right to the orthopedic. If you have a twisted ankle, you get one answer, one visit, one price. We schedule, we bill, we collect, we send the email, all without a phone call referral. What are we doing here? We're giving patients a new choice. You've got to recognize where they're going. There are 8,000 walk-ins. There are an average of 70 patients a day. There are more walk-ins in Massachusetts than there are zip codes. All we need to do is, there are 800,000 of us. We have capacity. We have empty seats. We have no-show rates. There's not one doctor, one specialist who doesn't have an empty seat in their waiting room. I'm asking you all to give me a house seat in your Broadway show. That's it. Just put aside one spot for someone who may want to skip the line and see what's happened. And honestly, in Massachusetts, it cost me $250 to go to a walk-in. Why not cross the street and go right to the orthopedic or the ophthalmologist for $300? Or your primary care physician who doesn't want to give up their panel, who doesn't want to not be a Medicare provider, who doesn't want to necessarily be a concierge doctor. In our model, they can sit in the direct pay world. So here we are. We started in a couple of states, Massachusetts, Florida. Every time a doctor has their email, they sign up. This network is exploding. I invite all of you to join. Why? Because it's free to join. We want to disrupt the system. We want you to participate. And we have specialties. We started off with surgeons. Now everybody's on this platform because they recognize the need for patients to have direct access and direct pay for a price that is, in fact, not higher, but lower. And we have now partnered with VC, and we can provide telemedicine capabilities to all our brick and mortar doctors. That means putting technology in the hands of the doctors to access better access and transparency. So we are about universal access and price transparency. We are fee for service, dirty word. No, doctors working for the patient. The patient is in charge, not the insurance, not the employer or the network. More accountability. We are aligning incentives of the doctor and the patient. Every doctor is available to join for free.
We're putting choice back into the system because fee-for-service doesn't make sense in a personalized medicine world. One size does not fit all. We leave hierarchical models for public health initiatives. We base our economic model on the sharing economy. The peer-to-peer relationship is actually not the disruptor. It's the common relationship. The hierarchical model is, in fact, the disruption. So we have recently partnered. We put our doctor in the middle. We have VC providing our telemedicine. UBERDOC provides access to doctors for direct pay. And we partnered with Global Health Impact Fund, which is building a bigger network of all sorts of tools for doctors to remain independent, to remain connected, to transcend the restrictions of our networks and what the system has imposed upon us, because we do not need this system. We just need to restore the doctor-patient relationship.
Thank you very much.